Fracture of the neck of femur. There are two types of fracture of the neck of femur. We have the intracapsular and the extracapsular. The intracapsular are called the fracture of the neck of femur, whereas the extracapsular are usually called the intertrochanteric fracture. Fracture of the neck of femur almost never unites, whereas intertrochanteric fracture unites readily. So this is the neck of femur and this is the intertrochanteric region. Pathoanatomy of the fracture of the neck of femur. Most of these fractures are displaced with the distal segment externally rotated and proximally migrated. These displacements can also occur in the intertrochanteric fracture, in which these are more marked. Intertrochanteric fracture is an extracapsular fracture. Being outside the attachment of the capsule, there is nothing stopping wide displacements. Classification of the fracture of neck of femur. The first one is anatomical classification. Under this we have three types, that is the subcapital, transcervical and the basal fracture. In subcapital fracture, you see fracture below the head of the femur. In transcervical, the fracture occurs in the middle of the neck. In basal fracture, the fracture occurs at the base of the neck. Pauwels classification. This classification is based on the inclination of the fracture in relation to the horizontal plane, which is the Pauwels angle. The fractures are divided into three types. The more the angle, more unstable is the fracture. Then we have Gardner's classification, which is based on the degree of displacement of the fracture, mainly rotational displacement. Stage 1 in Gardner's classification is the fracture is incomplete with the head in the posterolateral direction, so that there is an obtuse angle laterally at the trabecular stream, also called as impacted or abducted fracture. Stage 2 is wherein the fracture is complete but undisplaced. So there is a break in the trabecular system with little angulation. As can be seen in the diagram, the trabeculae between the head and the neck are broken. Stage 3 is wherein the fracture is complete and partially displaced. That is, all three sets of trabeculae are out of alignment. Stage 4 is wherein the fracture is complete and fully displaced. Mechanism of the fracture of neck of femur. In elderly people, the fracture occurs with a seemingly trivial fall. Osteoporosis is considered an important contributory factor. In young adults, this fracture is the result of a more severe injury. Clinical features of the fracture of neck of femur: pain and swelling, external rotation of the leg with the patella facing outwards, shortening of the leg, tenderness in the groin, attempted hip movement is painful and associated with severe spasms, active straight leg raising is not possible. Patient with an impacted fracture may acquire walking. The only complaint is pain in the groin region. Investigations include X-ray of the pelvis with both the hips rather than the affected hip alone. The following features should be noted: break in the medial cortex of the neck, overriding of the greater trochanter, break in the trabecular system or the trabecular stream, break in the Shenton's lines, external rotation of the femur with the lesser trochanter appearing more prominent. Other investigations include vascularization of the femoral head at the time of the surgery is determined by oxygen tension measurement, venography, isotope and bone scanning. Let's see the flowchart for the treatment plan of a fresh fracture of the neck of femur of less than 3 weeks. We have the undisplaced fracture and the displaced fracture. In case of undisplaced fracture, you have the conservative management or multiple screws. In case of displaced fracture, if physiologically less than 60 years, we have closed reduction, and if physiologically more than 60 years, we have prosthetic replacement. Under closed reduction under X-ray control, if the reduction is possible, multiple screw fixation is done. If reduction is not possible, open reduction and screw fixation is done. In case of prosthetic replacement with otherwise normal hip, hemiarthroplasty is done. If the hip has any other pre-existing arthritis, total hip replacement is performed. You can take a screenshot of the flowchart which is inserted right over here. Let's see the treatment part. For unimpacted or displaced fracture, the following implants may be used for internal fixation. So we have the multiple cancellous screws which are most commonly used, dynamic hip screws DHS, multiple Knowles pins or Moore's pins which are used in children. Then we have the Mayer's procedure. In this procedure, the fracture is reduced by exposing it from behind. It is fixed with multiple screws and supplemented with a vascularized muscle pedicle bone graft which is taken from the femoral attachment of the quadratus femoris muscle. Conditions of fracture of neck of femur, non-union, which occurs due to inadequate immobilization of the fracture. Treatment for this includes neck reconstruction, wherein the fracture is exposed from behind. The ends are freshened and the fracture is stabilized with multiple screws and muscle pedicle graft. The second one is Pauwels osteotomy. This is a valgus osteotomy which is performed at the level of the lesser trochanter. The valgus effect created at the fracture site converts the shearing forces into compression forces. The osteotomy is fixed with a double angle blade plate. Other complications are avascular necrosis, wherein the blood supply to the head of the femur is cut off, osteoarthritis of the hip, which may be seen due to avascular deformation of the head of the femur.